So everybody, this is Jody from the Center for Facial Recovery, and we're going to talk today about the differences and similarities between Bell's palsy and Ramsay Hunt. Of course, Ramsay Hunt's all over the news right now because of our friend Justin Bieber, and lots of kind of confusion between the two and the different kinds of viruses that cause facial paralysis. So I'm going to let Jody chat a little bit about that to us. Now, if you're on with us, you can type questions down in the feed. I'll try to keep up on them, and we can ask a few of those kind of throughout and at the end. Great. So I'll let you get started.
Okay, with Barbie, thanks for this opportunity. Just I actually, for everybody out there, all of Barbie's followers, I reached out to her just because, like with everything, there's a lot of misinformation, even by these newscasters that are out there. And certainly one of the things that our patients have been saying is, why are they saying 70% of the patients will get fully better after having Ramsay Hunt? And the media and even some of the physicians that they're interviewing are confusing the terms of Bell's palsy and Ramsay Hunt. They are different diseases, right? And then there's, if we talk about peripheral nerve injury, acute peripheral facial palsy, all right, there are really four main categories that can cause acute facial palsy, meaning that you wake up and all of a sudden that your face can't move. And those four things are Ramsay Hunt, which is shingles, actual shingles to the facial nerve. There's zoster synherpeti, which is shingles to the facial nerve, but you don't have these eruptions. So it's like having chicken pox without having the pox marks, but it's still that herpes zoster virus. And it's a bad attack on the facial nerve. Then you have herpes simplex. Herpes simplex is like what causes the virus that when you get a cold sore. And that's what causes Bell's palsy, the herpes simplex. In herpes simplex, those are the patients that are going to get better in 10 to 12 weeks. It's a very minimal attack. Think about when you get a canker sore, how long does that canker sore last? Versus if you remember back when you were a kid and had chicken pox, how long that lasted. So it's opposite ends of the spectrum. And then that impacts recovery, right? Because as how severe the attack is on the facial nerve, the harder it is for that nerve to recover fully.
To grow back.
Correct. Well, not even to grow back necessarily, because so if the nerve goes from point A to point B, that nerve is still there, point A to point B, but it's the ability for it to send its signal.
To fire.
Exactly. Because I don't want people to think, oh, it's only here, and then the neural pathway is there. It's just not sending that signal down that area. The other thing I want to correct before we get any further is they were saying that Ramsay Hunt only occurs 5 cases in 100,000. That's at least what I watched when Good Morning America reported on this. So just to throw some facts at you guys, and this is just for the United States. In the United States, there are reported 40,000 new cases of acute facial palsy per year. And when I'm kind of a math geek, so when you break that down, that's 3,333 per month. That's 769 cases per week. That's 109 cases per day. That's 4 cases per hour. Okay. Wow. So it's much more frequent than a lot of people make it seem.
But that's all of the kinds of acute facial palsy, though, right?
So that's like the big wheelbarrow of facial palsy is 40,000. Then when we break that down into other numbers, 15% of those patients, so even let's say if there's 100 per day, just to make numbers easier to do, 15%, so 15 patients will have Ramsay Hunt. 25 patients will have zoster synherpeti. 57 patients will have herpes simplex, which is Bell's palsy, and then 3% of the patients have it from Lyme disease.
Oh, right. Lyme's disease too, right.
So those will be the four main things.
Mm-hmm.
When you have such a severe attack, as many of you have experienced, right? If you truly have Ramsay Hunt, you're going to have a rash. You're going to have vesicles either in your ear or on your tongue, inside your mouth, or your ear is going to be swollen. You're going to have a lot of pain. And it's interesting because when you have Ramsay Hunt or zoster syn herpeti, your pain actually starts more after you have your facial weakness than before. With Bell's palsy, typically our patients say they'll have terrible pain for like 24 hours, and then they get the facial palsy and the pain goes away. With
And
our
it's
patients,
shorter, shorter period, right?
exactly. And with our patients with Ramsay Hunt or zoster syn herpeti, you get facial palsy, and actually the pain becomes more intense.
Mm-hmm.
You have more pain because that inflammation is just pushing on the facial nerve, and it's pushing on the trigeminal nerve, which is the nerve that gives you that pain sensation in that area.
And sometimes people with Ramsay Hunt have pain like for a very long time.
For a very long time. And usually when you have pain for a very long time, what the typical doctors do, well, they'll throw gabapentin at you, which is like a nerve, a medication to calm the nerves down, but they're not treating the reason why you're having so much pain. And the reason you're having so much pain is that darn facial nerve is still inflamed. Right.
Okay.
And until we take care of that inflammation of that nerve, you're going to be in pain and your face is not going to move because that nerve can't send its signal, and it's in this very tight canal and it can't breathe. It's being strangled in there. And that's why the steroids are so important, and a high dose of steroids is very
at the beginning, important. Right?
Beginning.
And now, but you're saying even if I'm have Ramsay Hunt for a while now and the nerve isn't firing, now there's medication that I can be taking as well to reduce the inflammation?
So if you're having pain, so let's say you had Ramsay Hunt, you were diagnosed with Ramsay Hunt 6 months ago, right? Okay. And you're still telling me you're having pain, one thing I would ask is that you get another MRI. We need to know why. We can't just throw drugs at people. We need to know why. Now, if that MRI still shows that that nerve is inflamed, yes, then it would be appropriate to go back on steroids. It means that was not put out and that more steroids would be appropriate. If you're still in pain and the MRI shows that the swelling has resolved, then no, steroids would not be appropriate. And then we need to talk about some other agents to maybe, because then it's probably not the facial nerve that's swollen that's giving you the pain. It could be more of like a secondary problem, which is like a trigeminal neuralgia, that trigeminal nerve, which is very close to the facial nerve, also gets aggravated. But the other thing is the antivirals, right? The antivirals are very, very important. This is a virus that has attacked your body. It makes you feel crappy, right? It makes you feel tired. It can give you achiness all over your body. It just kind of, it hits you, and we need to give you an antiviral to help with the virus.
Yeah, that's what I had. I didn't have a lot of pain. So, you know, I've seen you for appointments. So I didn't have Ramsay Hunt. I had no pain like or anything, but I was so tired. So these four kinds of facial paralysis that we're talking about here now, they're all viruses, right? So you would always need antivirals?
No, well, yes. I mean, the Bell's palsy, the research is a little, the research isn't so clear on Bell's palsy and whether you should be on antivirals and steroids. The issue is when you first present in the ER or to your doctor.
Yeah, we don't know whether it's...
We don't know. I mean, it's pretty clear that you have Ramsay Hunt because we see these red eruptions. But sometimes you don't get those eruptions until like 4 days after you have this pain and facial weakness. So our feeling is that everybody should be treated the same. Everybody should get high-dose steroids and antivirals.
and
right?
typically more than what people are getting from the information that I've had and you've shared, and higher dose. So I do really feel for myself, I didn't take enough antivirals or
Or steroids.
prednisone for what I was given, which is too bad. But if people are watching, the book that the Center for the Foundation for Facial Recovery has put out is called Fix My Face, and all the amounts are in there. So that information is really good to take to your doctor if you are newly diagnosed or come down with it. So yeah, so Ramsay Hunt now, this is the information that's out there that people are asking. So, I think that we can safely say it is more serious, right? And we tend to see
Right.
people who have worse kind of outcomes. I shouldn't say worse, but more challenging outcomes for their facial
Well,
paralysis and such.
Barbie, you and I've been talking for a while now. We know each other very well. So for your audience, they might not know me, but I'm a pretty honest, straightforward person. And I hate to be the bearer of bad news, but if you have Ramsay Hunt, I cannot get you 100% better. Okay. I wish I could. I really, really, really wish I could, but I can't get you 100% better. The goal is to get you 85% better, 90% better would be fabulous. If you get on the right medication regimen and are diagnosed properly, then we can get you 90% better. We've done that. Okay. It's for patients who are not diagnosed early enough and do not get the right medication regimen that will never get up to that 90%.
But if you are, you have been diagnosed. So Megs Lewis, I've done a talk with her and she had a question. She's 70, I think, and she's had Ramsay Hunt. Now there still can be improvement after a significant amount of time.
We do that. We see significant amount of improvement. We can do that. I just can't promise I'm going to make you totally 100%.
Of course. And I don't think for any kind of medical doctor in any kind of thing, facial paralysis or otherwise, should be saying that because everybody's different. And of course, and it does take a lot of work on the patient side as well. Like Jody's given me a ton of exercises, and if I'm not going to do them 3 times a day with, you can't wave a magic wand. So that is the thing with facial paralysis that I've experienced myself, is the muscles are so tiny and it's so frustrating.
Right.
But it's not just a magic pill, unfortunately, that we can take with facial paralysis.
Yeah, I had a patient in the clinic today, and I was saying to her, because we were going through the neuromuscular re-education, and I said, this whole process is like watching paint dry. It's a slow
that
process.
Is a good,
It really is. It's, nobody has a quick fix, and you unfortunately do have to put the time in. If you put the time in, you will get better. You will get better. But if you have Ramsay Hunt or Zoster Herpeti, 100% recovery is a false hope. 90%. I can tell you, if you're getting the right treatment and so forth, 90%. And what does 90% mean? It means that Barbie and I look at you and we won't even know that you have facial palsy. That 10% is more of an internal feeling, right? Yeah, sure. As you all know, you'll talk to family members and they'll say to you, I don't even notice. I can't even tell. But you're like, I feel the tightness in there.
The tightness is more.
Right. I feel the eye twitching, and that's where that 10% comes in.
Or when you're more tired, or
if you get sick, if you get a cold, your face is now your Achilles heel. So if any of you have suffered with chronic back pain, like if you're not feeling well, if you're fatigued and stressed, you're going to flare up your back. Well, that's what happens with the face. This is now like kind of your Achilles heel. You can get better. You definitely can get better. We have the exercises, we have techniques to help with decreasing the synkinesis, improving the motion. All of that can get better.
But you also told me too, in the Achilles tendon concept, is that it's a regular thing. It's not like, okay, Barbie, you're going to do these exercises 3 times a day for a month and then you're home free. So unfortunately, getting a facial paralysis or a facial palsy is kind of a lifetime kind of thing.
It's unfortunate. It's a chronic disease. It is. And I am hoping, I really feel bad for Justin Bieber, but I am hoping this will help all of you, because now there'll be a more of awareness of
100%. Hmm.
how devastating this
Hmm.
disease is.
Yeah.
And nobody, I don't want to say nobody, but there are a lot of medical professionals out there that really kind of poo-poo this, you
Hmm.
know. Well, it's your face. At least it's not cancer. I can't tell you how many of my patients tell me that they've seen it, this,
Totally.
that,
Yeah.
right? Or, or they're told you'll get better or you won't get better.
Hmm.
Well,
Or yeah, the doctors, people will go, somebody just asked a question. Please share the exercises. Tracy, if you go to the Center for Facial Recovery page, they have a lot of great exercises there. And then you can also see them by Zoom. So you can do an appointment for yourself. I see Jody by Zoom, and she gives me exercises right there. It's fantastic. So if you're in Australia, it's very available to you. And yes, the medical, or on Instagram, people saying, do this and you'll get a full recovery, is really, really bad, because in anything, if you have a broken arm, we shouldn't even say you're getting a full recovery, because you don't know. You don't know if your body's going to heal right. And that, to me, is very misleading. There's some coaches and things on Instagram saying, okay, we'll do this. Well, like you said, if you have Bell's palsy, you're getting full resolution anyways. So there's no kind of real, and correct me if I'm wrong, but there isn't really any major need for any intervention other than the antivirals and the
I think
steroids.
steroids and antivirals, you just
Yeah.
it's not, it's going to do it. It's going to just snap it, get that facial nerve to function, and then return. Now, the other thing is if you have Bell's palsy, right, you're going to have facial weakness, but it's not the same facial weakness that those of you who have zoster herpeti or Ramsay Hunt suffer from, right? So when we do scoring of the facial grading, when we look at what moves, what doesn't move, like a score of somebody who has Ramsay Hunt, 100% means you're totally normal. And Barbie, do you mind if I use you as an example? Would that
No,
be
I was just going to say, yeah, let's use me for an example,
okay?
so people can
Okay.
use the
Yep.
numbers.
Yep. Great. So when I am doing grading, we look at Barbie and we look at her at rest, and she looks really good at rest, right? Barbie looks great at rest, so that's good. Then we ask her to raise her eyebrows. So raise your eyebrows, and that looks good as far as the movement of one versus the other, right? So the 1 means there's no movement, 5 means there's normal movement. So with Barbie, I would give her eyebrow raise of 5, but the problem is you can see her mouth moves. You can see that synkinesis. So that's that you kind of deduct a point for the synkinesis because of that. But her eyebrow moves. Close your eyes for us, Barbie. Okay, that's good. That's a 5. She can close her eyes beautifully and open. And show me your upper teeth. Good. Okay, so this is an area that Barbie has some weakness in. You can see that when she shows the upper teeth, we can really see the teeth on that left side. And the right side is coming up. And I'm going off track here for a second, but the reason that it's Barbie's showing her upper teeth might look a little asymmetric is really not because of the weakness of her upper lip. It's the lower lip not coming down, right? And so if she holds that down and now shows us her upper teeth, do you see how different that makes her look? So that's a weakness that she has there. Now go into your smile, Barbie. Good. Same thing. Her smile is very good at the upper lip. Barbie's issue, which is similar, probably a lot of you have the same thing, is this lower lip issue, that lower lip weakness there. So when she pulls it down, you can see that she has a much more symmetric smile. The other nice thing is when she pulls it down, you can see that her eye synkinesis is less, right? Because she's not working as hard. So when she's smiling without holding it down, the eye really narrows on her. And then when she pulls it down and assists it a little bit, her eye opens up. All right. And those are examples of some exercises. But when we're talking about, this is type of the grading that we do. So when I see you initially, and if your face is fully drooped right after you had facial palsy, so meaning that you can't move your eyebrow, you can't close your eye, you can't smile, you can't snarl, you can't pucker, that gives you a very low score. And that is what we see typically with patients with Zoster-Sin-Herpeti and Ramsay Hunt. When you have Bell's palsy, you have weakness, but not the severity of the weakness.
Right.
Right?
Right. And like we said at the beginning, of course, upon diagnosis, you have the facial palsy and there's no way to know whether it actually is Bell's palsy or not if those, if the sores don't show up or there's no pain, right?
Correct. If the sores, so I will say with seeing as many patients as I've seen over the years, and I can't, I can't point to the specific research, but this is clinical observation that I see. If you have pain and it goes away in 2 days, and you have weakness, but your face is not fully drooped, and you can close your eye fairly well, then most likely you have Bell's palsy.
Right. Okay.
If you have pain and you have trouble closing your eye, if you don't have the sores, the eruptions is pretty crystal clear that that's Ramsay Hunt. But if you don't have that and can't close your eye well, and you have the pain, and you have either the ringing in the ear or balance, you feel like your balance is off, you have metallic taste, you have a cane taste, right? You have difficulty blinking. All of those types of things lead us more down the road of the Zoster-Sin-Herpeti.
Yeah, that's what I had. I had the metal taste and things like that. Now, somebody asked how long after. So if I come down with Ramsay Hunt and, we're sure it's Ramsay Hunt, it gets progressively worse for how long typically?
So again, it depends on the intervention, right? It depends.
Yeah, fair. Okay, yeah, fair. Yeah.
Right. Because if you get on the medication quickly, then we're going to stop the inflammation. We're going to stop the virus so that it won't spiral out of control. But if we still have inflammation going on and we still have the virus attacking the nerve, it could continue to weaken. You'll see maybe weakness continue.
But for how long? Okay, so say, typically, of course, in a perfect world, we would come to the Center for Facial Recovery right away, but 99% of us aren't that lucky.
Right.
So you get the antivirals and the prednisone for a week or whatever they give it to you. Now, with Ramsay Hunt, pain can continue to get worse for a certain amount of time. What is typical? 6 months, a year, like forever?
But that's where the intervention has to be proper, right? Because if you have Ramsay Hunt or Zoster-Sin-Herpeti, if you're talking about this pain that you're having that's actually kind of getting worse and not better, you need to be on high dose steroids for 3 weeks.
Okay. Even if it's been 6 months?
That gets back to the MRI, right?
Right. Yes. Right.
If the MRI shows swelling of that nerve, then consideration of being back on steroids is necessary.
Okay,
right.
So that's something, if you have Ramsay Hunt and you still are having pain after 6 to 8 months, somebody asked that question, to definitely give you guys a call, or definitely at least talk to your doctor for getting another MRI.
Please talk to the doctor and do an MRI and see what's going on. See if there's any more inflammation going on in that area. And at the least, if the MRI shows no inflammation, right, then I wouldn't ask the doctor to put you on steroids, because steroids, has some negative stuff. So you don't want to put anybody on medication lightly. But if you're still having pain, going on antivirals is a lot less impact on your system. If you don't have problems with your kidneys, antivirals are easier for the body to take, and that could help to suppress the virus, because if you're still having pain, something's going on. Now,
like with anything, right? If you have pain, something's going on.
Another thing that I'm not sure your audience considers, some of the pain that you could be getting, though, is actually could be from your jaw itself.
Right. Yeah.
And we do see that because for so long, think about how you were not chewing on your facial
Yeah.
palsy side, right? And so you were overutilizing the other side, and that causes an imbalance of your jaw. And jaw pain could mimic actually the original symptoms you had when you were developing facial palsy, like the ear pain, the pain behind the ear, the back of the head pain. What we call TMD, or problems with your jaw, can give you that type of pain. So the pain, if it's 6 months down the line, might not actually be from the zoster syn herpeti or from the Ramsay Hunt. It could be that you're having some jaw issues that should also be checked out, and something as simple as being put in a appliance, an occlusion that will help with clenching and balance out your bite might be very beneficial.
So it's just kind of after effects of the virus. It's not actually the virus is gone, like, is because that's what my situation is, right? Like the virus is gone. There's no inflammation. It's all gone now.
Right.
It's just the after effects and the residual of this muscles kind of taking over and that kind of thing. So somebody asked you, what if you have continued inflammation but no pain?
Well, then how do they know they have continued inflammation?
Oh, good question, CP Forever. How do you know you have inflammation? Okay, so so we can have continued symptoms from the virus. You know, just for people who are joining us, I had facial paralysis. You know, obviously my branding says Bellspalsy, but coming to learn what I have from Jody, I never had Bellspalsy. But I had the how do we say it again?
Zoster syn herpeti.
That's what I had. So the virus is gone now out of my system. Obviously, it's been 7 years, but this is kind of the after effects of things, which can be helped. That's what we're talking about. There can be exercises. I have them. I see Jody. I'm not as good with the exercises as I should be. That's a goal of mine this summer. But just because you didn't get lucky, you can get the care right away the next day that you got the facial paralysis does not mean that it's the end of the world and there's no hope for you. So that's kind of what we're chatting about today. Tracy's asking about Botox. Yes. So Jody likes Botox to talk about.
So for Barbie, Botox is definitely a good tool for us to have in her toolbox. The Botox helps us calm things down that are overactive. So in Barbie's case, her platysma muscle, the muscle here at the neck, is overactive, and when that muscle is overactive, that pulls on the whole lower part of your
pulls, and it's tight all the time, like so tight. Yeah.
So that's a great area for Botox. That's an area too that they do, like if it's very severe and you don't want to continue getting Botox, there are some good surgical interventions.
And that's the thing too. And that's where I was really confused about the Botox situation that you explained to me, because, you know, obviously having facial paralysis, the last thing we want to do is jab stuff into our face that paralyzes muscles, right? It's freaky. But now understanding is that these muscles are overactive. You're not paralyzing anything. You're making them just like, let's just have a little break, like let them calm down for a little bit. Maybe then they can stretch out and, you know,
correct.
They're not so tense all the time.
And I call the platysma muscle like the appendix of the face. It's an unimportant muscle, right? We don't really want to Botox too much your facial palsy side. I mean, we'll do the eye for the synkinesis of the eye, but you know, there's always good and bad when you do Botox, right? Botox stops things from activating, but then that's bad because it stopped things from activating. So for those of you who have eye synkinesis and will do Botox around the eye, then it'll make it that the eye doesn't narrow so much when you smile or pucker or eat. But the negative is it could also make it that you can't close your eye as well.
Yeah, that's what happens with me. I have the Botox around here, and I notice that I do just really, especially, of course, when I'm sleeping, I have to put it down before my eye mask and have the eye drops and everything. But yeah, that happens to me for
Right.
sure.
Those are that would be the only Botox I would really do on my facial palsy side. Really would be like the eye, this platysma, definitely. And sometimes we'll do it up in the forehead, depending on whether there's hyperactivity. So some of you might experience that your eyebrow is really high up on that side. So we would use some Botox to help bring that down, to relax it. But Botox into the mid part of your face, the part of your face that helps you smile and pucker and snarl, we don't Botox the involved side of that face because that'll minimize your ability to
do at least what you can do.
Right.
Now, everything that we're chatting about right now, though, is all similar in any kind of facial paralysis or palsy that we're talking about, regardless of whether it's, Bell's palsy, Ramsay Hunt, or
right. So again, with Bell's palsy, and I'm going to put myself out on a limb here. With Bell's palsy, you're not going to develop synkinesis.
Right.
Okay. With Bell's palsy, you're going to get better. The synkinesis, what we have seen based on clinical research, is the longer it takes your eye to close, the higher the risk you are of getting synkinesis and the more severe synkinesis. So again, getting back to Bell's palsy, typical Bell's palsy, you'll be able to close your eye within 8 to 10 weeks. And so the risk of developing synkinesis is decreased significantly.
Right. And and also too, you said last time we talked, that's kind of more fairly new, about like not only keeping the eye closed to keep the eye safe, but keeping the eye closed to prevent synkinesis. Now,
well,
or am I wrong?
Yeah, no, you don't want to keep it closed to prevent synkinesis. You want to help it close better, right? So you want to assist it. It's not that you don't want to tape it closed to prevent synkinesis. You just want to assist it that it can close better.
Right. Okay. Yeah, when you're blinking or whatever.
You say an external eyelid weight, or taping techniques, or there are those of you who've had actual internal weights put in the lid or had surgery to tighten up the corner, things like that to help close the eye, but not like closing it
like forever,
right,
or whatever, for months. Okay, so I think that we've covered a lot of information. I'm going to try to clip the video into little bits this weekend, because I really think that we have a lot of information that we got just from today. Is there anything else that we kind of missed that you wanted to throw out? I know there's always lots of information when you and I chat, because I have so many questions.
I just don't get your medical advice from the news. Say. Seek out a clinician who is experienced with facial palsy, especially those of you who think you might have zoster herpeti or Ramsay Hunt. If your doctor says, I've never seen a case of Ramsay Hunt before, you need to find a different.
Look for someone else. Someone's asking permanent dizziness 5 months into palsy. So 5 months and she's still feeling dizzy.
Yeah, so she has Ramsay Hunt. She has Ramsay Hunt, and so again, a MRI would be appropriate so that we can see, because the nerve that gives you that permanent dizziness is your vestibular nerve, which is, when we're talking about cranial nerves, the facial nerve is number 7. The vestibular cochlear, the one that helps you with the hearing and the balance and so forth, is number 8. And so you would want to have an MRI. Let's make sure that there is nothing going on with that nerve, that you're still having dizziness with it. And then there are different degrees of dizziness, different classifications, but there is physical therapy, very specific physical therapy, that's called vestibular therapy. And there are physical therapists that just specialize in this, and they could give you exercises that would help to decrease those.
I did that after I had my concussion as well. So maybe a clinic that would do concussions would be somewhere to find that specialist as well. So anybody who is on the call, a quite a few of you have asked here in the chat, you can contact Jody at the Center for Facial Recovery. It is all over my feed. There's tags everywhere. I see Jody personally over Zoom. She is available to you. Please see the Center for Facial Recovery, because the information is so much and so passionate and so caring. So thank you so much for joining again, Jody. Of course, love talking to you. You and I could talk on for about 4 years.
Yeah.
And we got a lot of stuff up our sleeve for everybody here. And everybody have a wonderful day. This, of course, will be available on the feed. Please share it, and make sure you contact Jody and her team at the Center for Facial Recovery. Everybody have a great day.
Thanks, Barbie.
Thanks. Bye.